wait. Before you hurriedly say I do to your life partner, before you hurriedly say I do, I want to spend the rest of my life with you, I think you need to watch and see this video. Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 6 tests that you should do before you say I do. 6 tests that you must do before you say I do. Don't say I do if you've not done these 6 tests, because it is very important. You're spending the rest of your life with this person. You're telling this person, I'm going to spend eternity with you. I'm going to stay with you till death do us part. So before you make such commitment, it is important you do the 6 tests. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Welcome back. Like I earlier said, today I'm going to be sharing with you 6 tests that you should do before you say I do. Without wasting much of your time, let's go straight into the point. The first one is fertility test. Fertility test, especially for couples who intend to carry their biological child, who intend to give birth to their biological child, because some couples might not want to give birth to their biological child, might not want to go through the period of pregnancy, they may want to adopt children, they might want to do something else. But if both couples, they've agreed that they are going to be having their own biological child, they don't want to adopt child, it is important for them to do this fertility test. For the men, they can go through what is known as the semen analysis, seminal fluid analysis, where the semen is analyzed for movement and all that. If you've not watched our video on semen analysis and what you should take note of, I'm going to be leaving the link in the description box below so you have access to this video. And for the women, they can be advised to do some pelvic scan. Yes, the pelvic scan helps to check if the pelvic organs, that is the reproductive organs, are intact and have nothing to worry about. Then another one is hormonal profile. This hormonal profile helps to tell the woman hormones. It helps to analyze the woman's hormones. We all know that as a woman, a lot of things, a lot of changes, a lot of hormones are doing their jobs in our body. So when it comes to pregnancy, when it comes to ovulation, when it comes to fertility, knowing the hormonal profile, it's very important. So for couples that intend to give birth to their own biological children, it is advisable they do the fertility test. The second important test that I would like to share with you is the test for sexually transmitted disease or sexually transmitted infection. Sexually transmitted disease is interchangeably used for sexually transmitted infection, and sexually transmitted infection is interchangeably used for sexually transmitted disease. For the course of this video, permit me to use it interchangeably. So if you are ready to spend the rest of your life with this particular person, it is important that both parties get screened thoroughly for sexually transmitted infection. When some sexually transmitted infections are detected, they can easily be treated with some antibiotics. But when that of HIV is detected, they can be given some treatment dose that help them to decrease the viral load. So when both parties know their history, they know, oh, this my partner is HIV, it kind of help them to know how to act. It kind of help them to know what to expect. Not getting married to a particular partner without knowing their STI history, and at the end, when you have skin to skin, you have flesh to flesh case, there is a transfer of sexually transmitted infection and there is a transfer of sexually transmitted disease. So knowing your sexually transmitted infection status is going to go a long way, not only to build trust, but to know, put it in at the back of the mind what each parties are expecting and what they hope to see in this marriage. I'm not saying that when a person is HIV positive, you can't get married to the person. You can, but at least you have the knowledge that, my partner is HIV, she is on a treatment dose, and we can do this, we can do that, and we cannot do this. So that is the second test. Then that takes me to the third test, which I want to share with you, and that is chronic medical condition. Yes, chronic medical condition. These are not things that you can easily go and say, oh, I want to do tests to know if my partner is this or not. Let me tell you something. Some chronic medical condition like diabetes and hypertension, it is important for you to know as an individual, especially when you people want to spend the rest of your life together. When you've done the test, you know, oh, my partner's blood sugar level is high. It gives you an insight of what to expect when you are in your marriage, especially when it comes to diet. Yes, because people with diabetes, they have special diets. People with hypertension, they have restrictions in their food. They have to take less of salt, less of spices in their food, less of sodium in their food. Same thing applies to people with diabetes. They have restricted diets. There are some things that they should not take in terms of sugar and all that. So when you as their spouse know, especially the wife, and you are the one preparing the meal, it gives you an insight of what to put in their food and what not to put in their food. It gives you an insight if you are going to be preparing two different meals, or you are just going to be preparing one meal, and you will learn to adjust. So that is why it is important to know if your partner has what? A chronic medical condition. Then the fourth one I want to share with you is the blood group. Yes, the blood group is very, very important. Most times we talk about genotype and neglect blood group, but I want to talk about the blood group first. When I talk about the blood group, I'm talking about blood group O, blood group A, blood group AB, and blood group B. Yes, it is important as couples for you to know your blood group compatibility. That is where you hear of resource incompatibility. That is where you hear of blood group incompatibility. Because when you know your blood group, you know how compatible you are when it comes to your blood group. It helps to prevent resource factors complication for your child and for yourself. It helps to prevent unnecessary miscarriages. So it is important you know your blood group. Then the fifth test you should do is your genotype. Yes, there is a lot of advertisement, a lot of social media sensitization about genotypes. If you are a couple that want to spend the rest of your life with and you want to have children biologically, it is important you know your genotype, because I know as an individual, you would not want to give birth to a child that will be in pain for the rest of his or her life. You will not want to see your child go through such pain, such agony, because that child is a sickle cell anemia patient. Whether you like it or not, this sickle cell anemia patient tends to put this stress, this pain, this agony in your life as a parent, and you will not want to go through that stress. So if finally you do the genotype group and both parties are AS or SS there is, it's advisable you speak with your doctor for treatment options and how to conceive and reduce the chances of you giving birth to a child with SS, or you can decide to annul the marriage if you want to. Yes, so genotype testing is very important for both parties to know their genotypes and also meet with their doctor for options when it comes to giving birth to their own children. Then the sixth test I want you to talk that we don't necessarily talk about, that we neglect, is mental health test. Yes, the mental health status of your partner, it's very important. Do they usually have mood swing? Are they usually anxious? Are they usually depressed? Are they usually emotional? The mental health of your partner is very important. It's not just schizophrenia, that is a madman roaming the streets, that is a mental health disorder. So it is important for you to know the mental health status of your partner, of the person you are getting married to. If you are finding it difficult to know the mental health status, in a more developed country, you can speak with a doctor, have a conversation, they do some psychotherapy and whatsoever they have to do to know your mental health status before you get married. See, mental health status is usually ignored because it does not have physical signs and symptoms, but it is very important for you to do the mental health test before getting married to your partner. That gives you an insight of, oh, will I be able to deal with an anxious patient? Will I be able to deal with somebody that is passing through post-traumatic stress disorder? Will I be able to deal with somebody that has mood swings? Will I be able to do so? Things like that. Is it also going to prepare your mind and help you manage this person, help this person avoid things that are going to aggravate these mental health issues. It will help you take those risk factors away from him or her and make them live happy. It will help you do well in your relationship. So if you're planning to get married, it's important you do this 6 test before marriage, because that is going to go a long way to help the marriage last longer. It will go a long way to reduce the divorce rate, and it will also go a long way for marriages to say, oh, we live happily ever after. So these are the 6 tests I have to share with you. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Bye, and see you in our next video.